you wrote the paper well. Most of the points you mentioned, but
Yes,
just
ma'am.
you just didn't mention that there's a pupillary block. Usually,
Huh.
basically the pupil which close, like this is let's say this is the lens,
Okay.
and this is the iris.
Okay, ma'am.
It gets closed like this, right? It doesn't, like there's no proper flow.
Yes, ma'am.
So just mention that there is a pupillary block. That's it. Everything else is fine.
Okay. Okay, ma'am.
And the clinical features also, you can mention redness, lacrimation, and photophobia in one place.
Okay. Yes, ma'am.
Yeah, the rest of the things are fine. Treatment में it's mannitol or acetazolamide.
Oh, correct. Yes, ma'am.
Both are the same
Yes,
class
ma'am.
of drugs, right? So it's
Correct,
oral.
correct. Mm-hmm.
And this is an acute scenario.
Mm.
And if it's just like subacute, then the drug of choice is pilocarpine.
Mm-hmm. Yes, ma'am.
Okay. So what it does is that it like the pupil is like this is the lens, so the pupil is like stuck here,
Mm. Yes, ma'am.
and
I can see
pilocarpine causes meiosis.
meiosis. Yes.
Yeah. So it helps in like stretching of the pupil,
Mm-hmm. Yes, ma'am.
which causes like clearance of the like fluid
Correct. Yes,
or
ma'am.
the aqueous fluid. Okay. Visual pathway also is good. Yeah, just ask for a diagram and see, you can draw. You can use two color pens actually. Color pencil,
Huh.
not color pens. Is it
Huh.
allowed in your university? I think it is.
I think yes, ma'am. We can use.
Except for red pen, I think you can use
Huh.
red
Except for
pens.
that. Yes,
Because there
yes,
are
ma'am.
nasal fibers and temporal fibers, right?
Mm-hmm.
Okay. And because you're done with visual pathway,
Yes, ma'am.
okay, fine. Just okay. You should like because you're done with visual pathway. I want you to like study about visual pathway defects. If that's fine, or you want me to explain it to you.
I didn't get you, ma'am.
There's these hemianopia, right? Those
Huh.
defects,
Huh. Huh.
visual
Yes, ma'am.
field defects.
Yes,
So
yes, ma'am.
like now that you've learned visual pathway, if you
Huh.
go through that now,
Huh.
matlab in like near future, you have it in your mind.
Yes, ma'am. Yes.
So will you read it, go through it, or do you want me to explain it to you?
No, no, no. I think I
You'll
can
go
go
through
through
it.
it. Yes, ma'am.
Yeah. But causes of red eye also
Huh.
is fine. And eclipse sign, you can draw a diagram. There's a diagram in the book.
Huh. Correct. Yes, ma'am. There is a
Okay.
diagram. Hmm.
Yeah, but everything else you wrote correctly. And Pincham's test also. uh, Actually, in Pincham's test, we use Stenope's slit.
Huh. Yes, ma'am.
So that slit is something like this.
Correct. Yes, ma'am. There's a split. Huh.
So if we draw that, uh, yeah, I think only these questions have asked, right? But you
Yes, ma'am.
know what Iris Bombay is, right?
Yes, ma'am. It is the synechiae formed by the attachment of the anterior part of the pupil to the lens.
Yeah, okay. So what kind of synechiae are present in angle closure glaucoma?
Posterior synechiae, ma'am, due to pressure induced by the
Both both will be present
huh?
in both will be present, anterior and
Yes.
okay. And so what is glaucom flecken?
Glaucom flecken, it is the cataract induced by closed angle closure glaucoma, ma'am, due to
Yeah,
attachment of pupil to the cornea, the lens. It induces opacity on the lens. This is which is in the form of a flecken. So glaucoma and
yeah.
flecken causes. Yes, ma'am.
Yeah, so the reason why this occurs is because of what? The lens gets necrosed, okay? This is
Huh.
why this happens. Okay? It's a
Yes, ma'am.
simple point. If they ask us a two marker, you have to write it down, right?
Yes, ma'am.
Yeah, and there's two like ways in which angle closure glaucoma can happen, right? What are those two like like patho like two mechanisms?
One is by attachment. One is by push mechanism. One is by pull mechanism, ma'am. In push mechanism, it is the lens that is attaching to the iris, which blocks
Hmm.
the posterior chamber. So the
Hmm.
produced
So
aqueous
aqueous humor
is
cannot travel.
huh. Second one is a pull mechanism when there is any pathology of the cornea, ma'am. So
So basically, you're trying to say phacolytic and phacomorphic.
uh,
Yeah.
I
So
didn't.
I wanted you to say I wanted you to mention phacolytic and phacomorphic. Like
Okay,
in
okay.
phacomorphic, the lens gets swollen, which causes a closure of the angle. And in
Hmm, hmm.
phacolytic, the lens starts breaking, which is why the lens materials go and they get stuck near trabeculae, which is why there's angle closure.
Yes, ma'am. Okay.
But these are secondary glaucomas, okay,
Hmm.
not primary glaucomas.
Yes,
You've
ma'am.
gone through secondary glaucomas, right?
No, ma'am. Secondary.
You didn't
Actually,
go through
questions.
them.
No, ma'am. Questions were also not asked. No, ma'am. So I skipped that one.
I think they are asked. Okay, fine, marked it. Okay. Yeah, just remember phacomorphic and phacolytic.
Okay, okay, ma'am. I
Just go
will
through
do.
them.
Uh,
Yeah. And yeah, so you know about colored halos right now?
Colored halos. Yeah, ma'am.
Yeah. So do you know why colored halos occurs, right?
Yes, ma'am.
Yeah, tell me.
Ma'am, it is a prismatic effect when eye is exposed to white light, ma'am, due to any obstruction or scattering of the white light. This happens mainly in three conditions. One is conjunctiva, where mucopurulent exudation is seen,
Yeah.
where the
Hmm.
mucous membrane acts as the prismatic effect. This
Hmm.
can be reduced while cleaning of the mucopurulent discharge. The other two conditions are glaucoma, and second one is, closed angle glaucoma, and second one is cataract.
Hmm.
Here, to differentiate between them, we use Wincham's stenopaque slit test, where when the slit is rotated and the vision and the patient is seeing the white light, the colored halos is appeared as a broken pattern in case of glaucoma, whereas
Yes.
in cataract it is a continuous circle of colored
I
halos.
think it I think it stays continuous in glaucoma and it breaks in diabetes. That right.
Oh, I told Ulta, I guess. Yeah.
Hmm. Okay, so basically in glaucoma it happens because the corneal epithelium is damaged
Huh.
from inside. That's why the reflection of the light happens in glaucoma.
Yes, ma'am.
So that's why even if you wash off the eye, nothing happens, doesn't change.
Yes, ma'am.
Okay, and yeah. So did you go through the slit lamp?
Not in too much detail, ma'am. I
Yeah, there's no
actually
need for too
didn't
much of
expect.
detail.
Uh,
Yeah, no, basically just I just wanted you to have an idea because it has the same mechanism as that of compound microscope.
yes, ma'am.
Yeah, so we use the same mechanism and we just to have a better view of the eye.
Yes, ma'am.
Okay? And yeah, so you're following Kurana, right? I wanted you to like read these like in the ending in
Hmm.
my edition. So in page number 544, it is given. In after clinical methods of ophthalmology, there are these like short like 2 mark questions.
Yes, ma'am.
You just go through them because
Yes, sir.
they are usually asked as like short questions, very short questions.
Oh, yes,
And
ma'am. Any common causes of red eye? Yeah, it's there.
yeah, so if you go through that, you can answer in Y1. You can also like you can answer a lot of questions. It is
Okay,
very simple. Becomes your job becomes easier.
okay, okay, ma'am.
Okay.
Yes,
Uh,
ma'am.
yeah. So there's not much that I can do today. Uh,
Yes, ma'am.
do you have any doubts?
No, ma'am. I think today was simple only.
Yeah. So you wrote the paper well. I gave you a score of 16 out of 20.
Oh, yeah. Thank you, ma'am. Yes.
Okay. Overall, the presentation was also nice. There's not many diagrams that we need in this question paper. So,
Mm-hmm.
did you write the summary on
No,
the
ma'am.
other
I
one?
have to write. No, ma'am.
Okay, just
I will
whenever
write
you
now.
write, just send it to them. Whenever you write, just send it to them. Okay.
Sure, sure, ma'am. I will.
Just before your exam, I want you to have it with you so that you can revise it because it's a big question. It's a big answer.
Correct. Yes, ma'am. I will write it now.
Yeah. So when will the next class be? I think this is your third class, right?
Third. Yes, ma'am. This is my third.
Yeah. So what topic do you want to study? Or
Next one,
what?
ma'am.
Mm.
I was thinking coming from backwards,
Mm.
like um, what do you think would be better, ma'am, to do next?
I was thinking neuro because it
Ma'am,
will.
new I need some good amount of time, ma'am, because last time when I studied, I didn't study well, ma'am. These chapters I had studied well. I can write.
Yeah. Okay. What about retina?
Retina would be fine, ma'am.
Okay. Okay. So go to retina and when will you be free next?
Tomorrow would be fine, ma'am.
For retina, one day, like half a day is enough for you because there are
Today
many
I'll
questions.
start.
There's retinoblastoma, there's optic neuritis. There are
Mm.
many questions in retina. So
Ma'am, actually, don't want tomorrow, ma'am. Day after tomorrow, I have my end postings in medicine. So after end postings only, I will write, ma'am. That day
when
only. Day after
today's
tomorrow.
Wednesday, right?
Today is Wednesday.
So
Friday, I will write.
okay, Friday. I'll send the question paper by Friday then.
Okay, ma'am.
By Friday, what time? Same time?
Same